Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. We are seeing or discussing in the series which is called as a Ayurveda in GP, that is Ayurveda in General Medical Practice. And nearly, I can say that 60 to 70 different health problems I have discussed in this series. Some problems have already been discussed and some will come within in a coming days. My dear friends, as you know, I am doing all these things with some sharing of knowledge and experience because I personally feel that is a need of the society. And that's why I am an MD in Ayurvedic medicine, MD in Ayurvedic physiology. I have the team of the doctors, and we both all together under my guidance, we are treating the patients online also. So for paid online consultation, you can definitely WhatsApp me at any time, 922681060. The number is already given in the description box. Let us start to discuss another deficiency from the food, that is vitamin C deficiency or ascorbic acid deficiency. The name of the disease is scurvy. And that this particular scurvy disease is giving the symptoms, for example, in the children or in the adult. The main important is affecting the erythropoiesis process and also the capillary fragility. So there is a bleeding gums. Gums starts bleeding. This is the first important sign that anybody can guess, oh, this may be person having some ascorbic acid or vitamin C deficiency. Then after a long time, there can be the hemorrhages in the subcutaneous tissue or under the skin also. That is called as a petechi. This type of ecchymosis, petechi, capillary bleeding will be there, dot spots, especially it starts in the around the ankle region, and then it may be abdomen or on the extremities. You can see the red colored spots that are because of the minute hemorrhages. So anemia will be there, ulceration in the gums will be there, stomatitis can be there. So this type of the various symptoms, the child will be more irritable and bleeding, ulceration, and these type of the problems makes the less immunity of the patient, and lot of repeated infections can take place. And at the same time, there may be the most important thing that I would like to tell is wound healing will be delayed. So be careful. Vitamins. That's why you can observe that every after the operative procedure, or if the patient is having the any type of road accidents or the wounds, whenever the patient comes to us for the dressing purpose, we invariably prescribe or give the tablet of vitamin C. In the market, it is available with the name Saline tablet, CELN. But most important, this tablet can be taken on the preventive basis who has a repeated cold attacks, for example. That also indicates that the person is having less immunity. In that way, this particular vitamin is safer to take because it is water soluble vitamin. B complex and vitamin C are water soluble, so they cannot remain in the body and can cause any serious side effects. The most important, most popular rasayan or the tonic in Ayurveda, that is Chavanaprash, which contains the amalaki or the amla fruit or the awala, which is a very, very rich source of vitamin C. So let us discuss a little bit about the causes, investigations, and how Ayurveda can help the particular problem of the scurvy disease. Okay, so this is etiology is deficiency of vitamin C, that is ascorbic acid. Usually, this particular scurvy is found from the age group 9 months to 2 years. More common in artificially fed infants, that means who are unfortunately not fed on the breast milk. Breast milk fed children usually don't get such type of the any vitamin or mineral deficiencies precipitated by febrile disease like fever, infections, or even the diarrhea. So what type of the investigations we can do in the cases of scurvy? Here they are. X-ray changes in the bones will be observed, increased density at ends of long bones seen as a white line. This white line of the Franket is a name of the scientist. Then signet ring appearance of epiphysis. These are all radiological findings. Then separation of periosteum from the shaft due to the subperiosteal hemorrhage. Ground glass appearance of shaft of diaphysis and penciling of cortex. So these are the X-ray changes in the bones, radiological findings, but very important for my students, medical students. Okay. So let us see how the Ayurveda is treating with the medicines. Of course, in addition to the particular medicines, we give the emphasis on the food, and also we give emphasis on the external oil, massage, etc. Chavanaprash, 2 teaspoons 2 times in a day with milk. Then Arogya Kadha of Hari Parashuram Aushadhalay, Ayurveda Pharmacy from Pune of late Khadiwale Vaidya Sir. Okay, 3 teaspoons with equal amount of water 2 times after meals. Kumari Asa. Why? Every time, whenever there is any type of the protein, carbohydrate, fat, vitamin, mineral deficiency, or whenever you find metabolic disorder, never forget the organ liver, because liver is the biggest factory or biggest industry in on the human body, which is taking place, which takes place or which takes the care to rectify the different metabolic processes. So in any metabolic disorders, never forget liver. And Kumari Asava aloe vera is the best tonic for the liver. So Kumari Aso, but for the children, number 3. For the adult, number 1 can be given 3 teaspoons with equal amount of water 2 times after meals. Make sure the child is having wholesome diet, which include the citrus fruits, leafy vegetables, especially the lemon. These are best to get what you can say the deficiency recouped by the diet, and the scurvy disease will be under control. So thank you very much, my dear friends. But I request all the time to you, don't forget to subscribe my YouTube channel, Ayurveda Academy, and press the bell button icon to get the notification of such fantastic videos, scientific videos, but in a simpler language by Professor Deshpande with some actions at some times. So thank you very much. I wish you all the best. Take care and see you in the next video. Thank you very much.